Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. Okay, so we're going to talk again about COVID-19. There's been a couple updates, a couple of things from World Health, and we are going to also report that Canada actually has its first recorded death in British Columbia due to COVID-19. So let's move ahead with the World Health Organization clip, and here we go.
Thank you, Tariq, and hope you had a very good weekend. I'd like to say good afternoon. First of all, I would like to start with a brief update on the Ebola epidemic in DRC. As you know, we have two fronts. It's now 3 weeks since the last case was reported, and a week since the last survivor left the treatment center. We're now in the countdown to end of the outbreak. We continue to investigate alerts and vaccinate contacts every day. And the security situation in northern Kivu remains fragile. In previous Ebola outbreaks, we have seen flare-ups even after the end of the outbreak. So we're continuing to provide follow-up care for more than 1,100 survivors and keeping teams on the ground to respond quickly to flare-ups if needed. The outbreak may be ending, but our determination is not. And nor is our commitment to combating the COVID-19 epidemic. As you know, over the weekend, we crossed 100,000 reported cases of COVID-19 in 100 cases. It's certainly troubling that so many people and countries have been affected so quickly. Now that the virus has a foothold in so many countries, the threat of a pandemic has become very real. But it would be the first pandemic in history that could be controlled. The bottom line is we're not at the mercy of the virus. The great advantage we have is that the decisions we all make as governments, businesses, communities, families, and individuals can influence the trajectory of this epidemic. We need to remember that with decisive, early action, we can slow down the virus and prevent infections. Among those who are infected, most will recover. Of the 80,000 reported cases in China, more than 70% have recovered and have been discharged. It's also important to remember that looking only at the total number of reported cases and the total number of countries doesn't tell the full story, except the potential the virus has. Of all the cases reported globally so far, 93% are from just 4 countries. This is an uneven epidemic at the global level. Different countries are in different scenarios, requiring a tailored response. It's not about containment or mitigation, which is a false dichotomy. It is about both containment and mitigation. All countries must take a comprehensive, blended strategy for controlling their epidemics and pushing this deadly virus back. Countries that continue finding and testing cases and tracing their contacts not only protect their own people, they can also affect what happens in other countries and globally. WHO has consolidated our guidance for countries in 4 categories: those with no cases, those with sporadic cases, those with clusters, and those with community transmission. For all countries, the aim is the same: stop transmission and prevent the spread of the virus. For the first 3 categories, countries must focus on finding, testing, treating, and isolating individual cases and following their contacts. In areas with community spread, testing every suspected case and tracing their contacts becomes more challenging. Action must be taken to prevent transmission at the community level, to reduce the epidemic to manageable clusters. Depending on their context, countries with community transmission could consider closing schools, cancelling mass gatherings, and other measures to reduce exposure. The fundamental elements of the response are the same for all countries: emergency response mechanisms, risk communications and public engagement, case finding and contact tracing, public health measures such as hand hygiene, respiratory etiquette, and social distancing, laboratory testing, treating patients and hospital readiness, infection prevention and control, and an all-of-society, all-of-government approach. There are many examples of countries demonstrating that these measures work: China, Italy, Japan, the Republic of Korea, the United States of America, and many others have activated emergency measures. Singapore is a good example of an all-of-government approach. Prime Minister Lee Hsien Loong regular videos are helping to explain the risks and reassure people. The Republic of Korea have increased efforts to identify all cases and contacts, including drive-through temperature testing to widen the net and catch cases that might otherwise be missed. Nigeria, Senegal, and Ethiopia have strengthened surveillance and diagnostic capacity to find cases quickly. Further details on specific actions countries should take in specific contexts are available on WHO's website. WHO is continuing to support countries in all 4 scenarios. We have shipped supplies of personal protective equipment to 57 countries. We're preparing to ship to a further 28, and we have shipped lab supplies to 120 countries. We are also working with our colleagues across the UN system to support countries to develop their preparedness and response plans according to the 8 pillars. And we have set up a partners platform to match country needs with contributions from donors. As you know, more funds are being made available for the response, and we're very grateful to all countries and partners who have contributed. Just since Friday, Azerbaijan, China, the Republic of Korea, and the Kingdom of Saudi Arabia have announced contributions. Almost $300 million has now been pledged to WHO Strategic Preparedness and Response Plan. We are encouraged by these signs of global solidarity, and we continue to call on all countries to take early and aggressive action to protect their people and save lives. For the moment, only a handful of countries have signs of sustained community transmission. Most countries still have sporadic cases or defined clusters. We must all take heart from that. As long as that's the case, those countries have the opportunity to break the chains of transmission, prevent community transmission, and reduce the burden on their health systems. Of the 4 countries with the most cases, China is bringing its epidemic under control, and there is now a decline in new cases being reported from the Republic of Korea. Both these countries demonstrate that it's never too late to turn back the tide on the virus. The rule of the game is never give up. I'll repeat that. The rule of the game is never give up. We're encouraged that Italy is taking aggressive measures to contain its epidemic, and we hope that those measures prove effective in the coming days. Let's hope the antidote to fear. I'll repeat this, let hope be the antidote to fear. Let solidarity be the antidote to blame. Let our shared humanity be the antidote to our shared threat. I thank you.
And so you heard from our health organization leadership that we need to set aside blame, we need to adopt hope, and our governments need to come up with comprehensive plans to contain and test for new cases. So, with that being said, there has been some criticism about how Canada is only actively. There's been some criticism within Canada, should I say, about how the health ministry is handling containment here within Canada, but I will point out something that was very well put, that Canada's 2 main airports and entryways from Asia into Canada are at Toronto and in Vancouver, with the 2 major international airports. So, let's move on to some other clips with that.
we're going to keep doing the things that actually keep Canadians safe. There is a lot of misinformation out there. There is a lot of knee-jerk reaction that isn't keeping people safe, that is having real challenging impacts on communities and on community safety. We're going to stay focused on doing the things that actually matter.
From a CBC news program, Power and Politics.
I want to ask you about the coronavirus and Canada's measures to prevent its spread. Did your American counterpart today express any concern over Canada's approach at the border, which does differ from the U.S.'s?
Actually, no, and we had a very good conversation. Myself and the acting secretary from Homeland Security spoke about the measures that we were both taking, and I think the sharing of information and the collaboration that has always existed between our two countries as we maintain the integrity and the security of our borders is really important. And I explained the measures that we are taking and how effective that they have been, and he explained their position. But there's very good collaboration between us, and frankly, it has not been a concern raised with me as to how we're each managing our border, especially the one between us.
Can I ask you a bit more about the borders, specifically what we've seen so far, at least the information that the federal government has supplied us with? All of the cases have been transmitted through travelers. It's not yet at the community transmission level. The fact that it is so closely associated with travel, is that giving you pause? Are you considering more stringent measures at the border, like we've seen either in the U.S. or a host of other countries? I'm thinking of Australia or Italy or Israel.
Well, let me be very clear. First of all, the illness first rose in Asia, and so the only way it could have come to North American borders was through travel. But we've put in very rigorous screening measures at our airports, and now this week we're also bringing in some additional measures for screening for land, rail, and marine entries into Canada. That screening is proving effective in identifying people that have come from the infected areas, and there have been quite a number of referrals to public health to make sure that the people coming from those areas are in fact screened. If they are in any way symptomatic, that's responded to very quickly, and those individuals are put into isolation and quarantine. And for those who could be at risk, we've also been taking measures with respect to those individuals. And to this point, our containment efforts have been certainly as successful as those undertaken in other countries. We know, for example, as you indicated, in the United States, in Australia, in New Zealand, and a few other places, they've actually put in travel restrictions and barring people from coming from those countries. We have, frankly, I think, a very robust system of screening for individuals coming from those places, and so that everybody who arrives, for example, from the affected area in China is subject to rigorous screening by our border officials and referrals to the public health officials, and that has proved to this point to be an effective measure of containment with respect to this illness.
Do you think those countries, and you use the example of Australia, they're the most recent ones to announce it, they've said that if you've been in mainland China, Iran, or South Korea, you're not allowed in Australia for 14 days from the time that you leave those countries. Do you think that's the wrong decision?
Well, and no, and one of the things I will not do is criticize the decisions made by others on how they are attempting to contain this, but we are working very closely with them.
Why isn't it the right decision for Canada?
Well, for a number of reasons. I think our ability to because of our relative isolation in the world and the fact that there are only a very limited number of flights coming from the affected areas, the screening measures that we've been able to put in place at the airport and with our public health officials has proven to be a very effective response. But at the same time, I'm very respectful of the measures that the Americans or the Australians have put in, which are right for their environments. We're working very closely together, and there is an appropriate level of information sharing, and I think that can be reassuring to Canadians. The steps that we have taken to this point have been effective and appropriate for in the Canadian context. And we're continuing to monitor that very carefully. But our success at containing this illness and keeping it out of our borders has been every bit as successful as those who have undertaken different measures. And so I think it's important to recognize what we put in place was based on our own capabilities, the experience of travelers coming to Canada and where they come. There's only 3 airports, essentially, where people were coming directly from China, for example, in Vancouver, Toronto, and Montreal. And so we were able to put in very rigorous screening methodologies there with our border security agents and with strong support from public health officials right at the airport working with our people. That has been very effective in identifying those individuals who were at risk or who had been affected, and then they were moved very quickly into a treatment facility and isolated to stop further spread of that disease.
Okay, so we have in Canada 54 confirmed cases. 28 of those cases are in Ontario, 21 in British Columbia, 3 in Quebec, and 2 confirmed cases in Alberta. It's just a few days ago that Alberta had their first confirmed case, and it was due to travel via a cruise ship. And, of course, in British Columbia, most of those are actually linked back to someone had actually traveled into Asia and came back into one of those affected areas. Canada does have its first confirmed death in due to COVID-19, and we'll get a clip of that report in a second. Hold on.
My name's Adrian Dix. I'm the BC Minister of Health, and beside me is our Provincial Health Officer, Dr. Bonnie Henry. We're honored to be here on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations. For the remainder of the week, we're going to move to a regular time for daily briefings on the COVID-19 questions. That will be at 3:30. The first briefing will be tomorrow in Vancouver at Vancouver Cabinet offices. And with that, I wanted to introduce Dr. Henry to lead to start today's briefing.
Thank you. Thank you. And I want to start off by letting you know that we unfortunately have had a death here in British Columbia. We are deeply saddened to hear that one of the residents of the Lynn Valley Care Home who was infected with COVID-19 passed away last night. And our heartfelt condolences go out to his family and loved ones, and also, of course, to the staff who provided him care, and to his home at the Lynn Valley Care Centre. We also have a number of new cases, and I'll start with talking about what is going on at the Lynn Valley Care Centre. We're up to 32 confirmed cases here in British Columbia now. As you know, the Vancouver Coastal Health has been on site at the Lynn Valley Care Centre since we first became aware that the community case that we had was a healthcare worker who worked at that centre. It's now become apparent that there are other people at that centre who were ill, a number of residents, as we know. So far, 2 residents have tested positive. There's ongoing testing and ongoing monitoring of all of the residents at the facility. In addition, one additional healthcare worker has tested positive for COVID-19. She's a woman in her 40s who lives in the Fraser Valley, Fraser Health Authority area, and she is home in isolation right now. In addition, we have 2 new close contacts of case 21, our community case, a male in his teens and a male in his 50s, and they both reside in the Fraser Health region and are isolated at home, and both of their condition is also stable. Over the weekend as well, we've identified 2 additional imported cases into British Columbia, a female in her 50s who has returned from travel to Iran, and a male in his 30s who is our first imported case with a history of travel to Italy. Both of them are in the Vancouver Coastal Health region, and both, again, are isolated at home and doing well. I will also give an update on our other cases. So we still have 4 people who have recovered completely. We are awaiting testing on a number of others whose symptoms have resolved completely. But as you know, we are requiring people to have negative tests before we say that they are fully recovered from this. And a number of them have been tested regularly, but do not yet have 2 negative tests, at least 24 hours apart. So we are monitoring those. We have 3 people who remain in hospital, 2 people in the Fraser Health region, and they're both in stable condition, and 1 person who remains in the ICU at Vancouver General Hospital and is also in stable condition.
Okay, so that's most of the updates that we have for right now on COVID-19. I do want to leave with this thought. Hand washing is very important, and making sure that you sneeze either into the crook of your arm with your sleeve, or some kind of cloth to ensure limited transmission of this particular virus or any other respiratory virus. Okay, so we will move on to other topics. And of course, there's been lots of debate and everything going on in the U.S. with there's going to be a new election coming along, and we have a little clip of a debate and a little question and answer series going on there. So listen to this. Here we go.
In order to beat Donald Trump, we're going to need the largest voter turnout in the history of the United States. Mr. Bloomberg had policies in New York City of stop and frisk, which went after African American and Latino people in an outrageous way. That is not a way you're going to grow voter turnout. What our movement is about is bringing working class people together, black and white and Latino, Native American, Asian American, around an agenda that works for all of us and not just the billionaire class. And that agenda says that maybe, just maybe, we should join the rest of the industrialized world, guarantee health care to all people as a human right, raise that minimum wage to a living wage of $15 an hour, and have the guts to take on the fossil fuel industry, because their short-term profits are not more important than the future of this planet and the need to combat climate change. Those are some of the reasons we're the strongest campaign to defeat Donald Trump.
Okay, that was Barry Sanders talking, and he was speaking on why he thinks that he is the person that can actually beat Donald Trump. I would warmly invite him to really stick to what he said towards the end about attempting to limit the control and short-term profits of the oil industry. Right now, it could be the oil industry could be one of the big ways to actually control our climate crisis. So with that being said, we will let you go, and we will talk to you again in just a few days. Thanks so much for listening. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.